Hi everyone. So my name is Imtiaz, and I'm a staff scientist at CAMH. And today I'll be presenting our research looking at the impacts of cannabis legalization on cannabis use and cannabis-attributable harms in Ontario. Oh, I think Tara's controlling the slides. Yep. Thank you. Before I start, I just want to acknowledge some of our team members, some of our knowledge users and collaborators, the research staff, and the funders who have made this project a possibility. Can I get the next slide, please? And before we begin, I would like to acknowledge that both Dr. Elton-Marshall and I have no conflicts of interest to declare. So next slide. So as all of us know, cannabis legalization, it was implemented on October 2018 across Canada. And the implementation of this policy, it actually differed across provinces and territories. And based on that, CHR and CCSA, they funded team grants to evaluate the impacts of cannabis legalization. And our evaluation, it focused specifically of the effects in Ontario. Next slide, please. So we're going to be presenting some of the work from this project today. And some of the key questions that we'll be focusing on are basically the effects on changes in cannabis consumption, changes in medicinal cannabis consumption, as well as cannabis impaired driving, and then finally health services utilization. And then we'll also be looking at what resources are needed for young adults who use cannabis. Next slide, please. So the first research question we have is, did the patterns of cannabis consumption change before and after legalization? Next slide. So the way we've presented the results is first we'll go through the findings specific to adults, and then afterwards we'll go to the findings specific to adolescents. So in regards to the adults, we obtained our data from the Center for Addiction and Mental Health Monitor, the CAMH Monitor, is one of the longest running population-based surveys in Ontario. And it uses computer-assisted telephone interviewing to ascertain responses to various different mental health and substance use items. And it is a probability-based survey. It is a probability-based survey. It includes regional stratification by 6 geographical units, as well as a 2-stage probability selection of telephone numbers. Next slide, please. So the outcomes that we were interested in looked at cannabis use, daily cannabis use, and cannabis-related problems. All 3 of these outcomes, they were dichotomized, and cannabis-related problems, they were measured using the World Health Organization's Assist Cannabis Subscale. And our main exposure of interest was cannabis legalization, which we coded as pre-cannabis legalization for all observations prior to October 2018, and post-cannabis legalization for all observations post-October 2018. And within these analyses, we accounted for a bunch of different social demographics, such as sex at birth, age, marital status, income, and education. Next slide, please. So these are the results pertaining to the adults. So as we see in the figure over here, the green line, it represents cannabis use. The gray line in the middle, it represents cannabis-related problems. And then the red line at the bottom, it represents daily cannabis use. So what we see is that from 2001 to 2013, there's a bit of changes, but it's mostly stable. And then after 2013, we start seeing increases in all 3 of these outcomes. And they continue increasing, and that line over there in the middle, after 2018, there's another increase afterwards. And this is important because as we saw in a lot of other presentations, a lot of these trends were increasing from before, but our modeling showed that even after accounting for those trends within our models, we still observe an increase within all 3 of these indicators. So specifically, we see that cannabis legalization is associated with a 62% increased likelihood of cannabis use, a 59% increased likelihood of daily cannabis use, and a 53% increased likelihood of cannabis-related problems. Now, we wanted to understand if these effects were consistent across age and sex groups, so we further tested for interactions by age and sex with cannabis legalization. Next slide, please. So what we see is that we found a significant interaction between cannabis legalization and age, suggesting that the impacts are differed by the different age categories. So within this figure over here, we present the model predicted probabilities for cannabis-related problems by different age groups and pre-cannabis legalization to post-cannabis legalization. So on the far left over there, we have the 18 to 34 years old age category. In the middle, we have the 35 to 54 years old age category. And at the far end, we have the more than 55 years old age category. The first two age groups, we don't see much difference between them, but we detected a significant interaction for the more than 55 years old age category. Specifically, we see that the probability, it jumps from about 2% pre-cannabis legalization to about 6% post-cannabis legalization. Next slide, please. So then we move on to the findings pertaining to the adolescents. So we had a similar methodology where we had a population-based survey, the Ontario Student Drug Use and Health Survey. And this survey has been running for a very long time, I think since the 90s in Ontario. And this is a self-reported survey which is administered to students within grades 7 to 12 in publicly funded schools. And again, it includes a probability-based design. And this survey is conducted on a biennial basis, so every 2 years. And as before, we combined all the waves of the survey into a pooled data set from 2001 to 2019. Can I get the next slide, please? And for the outcomes, we again tried to find similar outcomes as we had for the adults. So we had cannabis initiation, which wasn't included for the adults, but we had any cannabis use, daily cannabis use, and cannabis dependence. And cannabis dependence, it was measured using the cannabis subscale of the severity of dependence scales. And as before, our main exposure was cannabis legalization, pre-legalization, post-cannabis, post-legalization. And then we had some covariates that we adjusted for, such as age, gender, grade, and region. And our main analytical strategy, again, was logistic regression. Next slide, please. So unlike adults, the findings were not as clear for adolescents. So we can see from 2001 to 2019, pretty much for a lot of the outcomes, there is an overall decreasing trend. But what we see is that for a lot of these outcomes, after 2017, there is a bit of an uptick. So the top line over there in red, that's any cannabis use. The black line in the middle, that is cannabis initiation. The green line is daily cannabis use, and the blue line at the bottom is cannabis dependence. So for a lot of these outcomes, what we see is that from 2001 to 2017, there's an overall decreasing trend, and between 2017 and 2019, there is a bit of an uptick. So when we analyze this within our regression models, what we see is that cannabis legalization, it was actually associated with a 31% increased likelihood of any cannabis use, a 40% increased likelihood of daily cannabis use, and a 98% increased likelihood of cannabis dependence. In regards to cannabis initiation, we did not detect an association. We also tested for differential patterns of change by age and sex. However, we did not document any such effects. Next slide, please. So overall, in summary, what we see is that cannabis legalization, it was associated with an increased likelihood of any cannabis use, daily cannabis use, and cannabis-related problems among adults. Specifically in regards to cannabis-related problems, the effects are differed by age. In regards to adolescents, we saw that cannabis legalization, it was not associated with cannabis initiation. However, it was associated with cannabis dependence, daily cannabis use, and any cannabis use. Next slide, please. So the next question that we sought to address was, has medicinal cannabis consumption changed pre-post cannabis legalization? Next slide. So again, our methodology was pretty much the same. We only had the medicinal cannabis use variable available for the adults, not for the adolescents. So we pooled the data again from 2014 to 2019. The medicinal cannabis use item was first collected in 2014. And then we derived a composite outcome where we had individuals either coded as no cannabis use, medicinal cannabis use, with or without recreational cannabis use, and finally, recreational cannabis use exclusively. And our exposure, again, was cannabis legalization. And then we had covariates where that we adjusted for, such as the survey year, sex, age, education, immigration status, and marital status. Next slide, please. So again, we've mapped out the medicinal cannabis use and recreational cannabis use separately from 2014 to 2019. So we see that it has been increasing from 2014 to 2018, and then there's a bit of an increase again in 2019. And when we model this within the logistic regression models, we see that cannabis legalization, it was associated with a 48% increased likelihood of medicinal cannabis use compared with no cannabis use, and it was associated with 35% increased likelihood of recreational cannabis use compared with no cannabis use. And what's really interesting is we also collected data on whether participants had medical authorization to use cannabis. And what we see is that from 2014 to I think about 2017, we saw more and more participants were reporting they had medical authorization. But after legalization, we saw that the proportion of participants that had medical authorization to use cannabis, it actually decreased. Next slide, please. So overall, for adults, what we saw is that cannabis legalization, it was associated with both recreational cannabis use as well as medicinal cannabis use. Next slide. So the next question that we're going to look at now is if cannabis impaired driving changed pre-post cannabis legalization. And for this question, we sought to have two different types of assessments. So we obviously had the surveys that we could rely on that were the self-reported assessments, but we also obtained data from the Ministry of Transportation. So going to the first, to the self-reported data, we again pooled the data from the CAMH Monitor and the OSDIS separately for both adolescents and for adults. And our exposure again was cannabis legalization, and we adjusted for various different sociodemographics. And our outcome over here was driving within an hour of cannabis consumption within the past 12 months. Next slide, please. So among adults, when we plot this over here, it's a fairly noisy figure, and the error bars are quite high as well, because we restricted the sample to only those participants who had a valid driver's license. So because of that, the sample sizes are a bit more smaller. But overall, we see that there was cannabis legalization. It was not associated with driving under the influence of cannabis. But again, we wanted to test if there were any differences by age and sex. So we tested for multiplicative interactions between cannabis legalization and age and sex. Next slide, please. So over here, once again, we see that there was a significant interaction between age and cannabis legalization in terms of predicting driving under the influence of cannabis. So we see, again, the 18 to 34 years old category, the 35 to 54 years old category, and the more than 55 years old category. For the 18 to 34 years old, the model predicted probability actually shows a little bit of a decrease. For the 35 to 54, it doesn't change much. But for the 55 plus years old, again, we see that it's a bit of an increase. The predicted probability, it increases from a little under 1% to a little under 3%. Next slide, please. And then we also repeated the same assessment for adolescents to see if cannabis legalization was associated with driving under the influence. So we see over here that overall, driving under the influence decreased among adolescents from 2001 to 2019. And cannabis legalization, it was not associated with driving under the influence of cannabis. Next slide, please. And now I'll hand it over to Tara, who will be presenting the rest of the findings.
Look at whether or not there would be any changes in actual collisions in Ontario. And so we use data from the Ministry of Transportation, where they collect data on any collisions that happened. And in this case, we were looking at January 2005 to January 2020 reported by month. And we did that on purpose because we wanted to stop right around the time of the pandemic, given that there could be pandemic effects related to collisions. But it's really important to note with this data, it's just total collisions. So we can't attribute it to cannabis use per se. It's still important to note though, because if we're thinking that cannabis leads to any changes in collisions, we should still expect to see some increases in collisions. And what we found overall is that there were no significant effects of legalization on the number of collisions. So you can see that there are some different spikes that happen according to when the data is collected, but overall it's a downward trend, but nothing significant with our ARIMA modeling. We also looked at this using different analysis. So the regression discontinuity and a step effect, looking at different factors that might differ. So if there's multiple vehicles involved or single vehicle, if crashes happen at nighttime, daytime, if there's a female driver or a male driver. And again, we don't find any significant differences when we're comparing pre-post legalization. So to summarize our findings on the impact of cannabis legalization on driving, we found through a report that there was overall no association between driving under the influence of cannabis among adults, but that there were some impacts of legalization when you look by age, specifically with that 55 plus group. And cannabis legalization was not associated with driving under the influence of cannabis among adolescents. And then finally, when we looked at these administrative databases, we also didn't see any significant increases in the total number of collisions. So the next thing we wanted to look at is whether or not cannabis-related health service utilization changed pre-post cannabis legalization. And first, we decided to look at use of addiction treatment services. So we used the Drug and Alcohol Treatment Information System, known as DATIS, which includes all community-funded addiction treatment services where a health card is not required. And for these analyses, we used an interrupted time series design using seasonal autoregressive integrated model average models. And our outcomes were cannabis-related treatment admission, defined as cannabis being designated as one of the presenting problem substances in the admission. And our exposure was cannabis legalization. And again, we didn't find any significant results. So there were no significant changes in treatment service utilization for any service for which you don't need a health card. Now, again, we stopped our analysis right around the pandemic, so January of 2020. The next thing we wanted to look at was acute care services. So using data from ICES, we wanted to look at emergency department visits using data from the National Ambulatory Care Reporting System, as well as cannabis-related admissions to acute care using data from the Discharge Abstract Database and Ontario Ministry of Health Reporting System, or OMHRS. And we use diagnostic codes. So anytime it was noted that there was a cannabis-related disorder or poisoning or adverse effect from cannabis, and then the OMHRS used DSM-4 and DSM-5 codes. We used an ARIMA time series analysis, but we also did a breakpoint analysis. And that was informative when we were looking at acute care service utilization. So specifically using the breakpoint analysis, we wanted to see if there are particular time periods when there were changes in the slope of admissions or emergency department visits related to these cannabis diagnostic codes. And what was really informative is that for two of these breakpoints, they actually correspond to when there were changes in cannabis policy. So the first breakpoint we found where the slope started to increase was in August 2014, which was around when marijuana for medical purposes regulation came into effect. And the second breakpoint that we found was in April 2017, which was when the federal government tabled and put forward the bill, an act respecting cannabis. So what's really interesting to note here is just that we're seeing that pattern again where there's increases happening even before legalization actually happens. Overall, we didn't find, when you combine all the age groups, significant increases in admissions for to the emergency department. But of course, we see that trend with the 15 to 29-year-olds where it is increasing. And then we also looked at emergency department visits that actually resulted in admission to acute care. And again, that we didn't find an overall significant effect, but we did see that increasing group in the 15 to 29-year-olds. So to summarize, cannabis legalization was not associated with cannabis-related treatment admissions to community-based addiction treatment services. Overall healthcare utilization did not significantly increase pre-post legalization, but our breakpoint analyses demonstrate that there are significant increases in cannabis-related healthcare utilization that correspond to changes in the cannabis law or even in just discussion about the plans to implement the law. So what resources are needed for young adults who use cannabis? We wanted to ensure that there was a piece of this project that actually reflected the voices of people who use cannabis and determining what might be important for these individuals. So we used a mixed methods design. First of all, we had collected a baseline survey of a cohort of 2,464 youth and young adults between the ages of 16 to 30 years old who use cannabis in Ontario. And these individuals were recruited through social media and an existing cohort of people who vape from University of Toronto, Dr. Schwartz. And then we collected an initial data baseline survey in January to August of 2022, and we've just finished our Wave 2 follow-up in January to August of 2023. So I'm just going to present some of our baseline findings for the purposes of today. We also then did some qualitative interviews with 26 participants who had been in the baseline survey. We were interested in understanding more about the research questions, but also about what these individuals felt they needed in terms of resources, if any. And so we purposely selected individuals who frequently use cannabis, who are able to drive a motor vehicle, so we could ask some questions around cannabis and driving, who had been exposed to cannabis advertising in the last 30 days, again, because we also had some questions around cannabis advertising, and who were between the ages of 19 and 24 years old. And we purposely recruited individuals who represented both women, men, and gender diverse groups. And so what we found from the qualitative survey, first of all, was that 54% of the people that we sampled said that they were unaware of any specific supports or resources, and that 50% indicated that there were not enough supports for people who were wishing to get help with their use. Not everyone will want help, but for those that do, they felt that there weren't enough supports. And 23% of those said that there were not enough informational resources. Or 31% reported that existing resources and supports were not communicated well or were too general. And in particular, they seem to want to see more around how people can reduce their harms if they choose to continue to use cannabis. So, for example, in this quote, well, yes and no. So if you want to know more about a particular strain, all you have to do is go to the shop, and every person I've talked to that works at a store is very educated on what they're talking about. And, you know, they'll tell you about it. In terms of how it affects your body, no. I don't think that's really enough. There's enough on that because you get a lot of mixed messages. In terms of supports, no, I have not seen any support for people trying to change their habits and stuff like that. So again, people felt that they needed a little more information about how to actually protect their health. We also looked at data from our quantitative study, our baseline cohort. And what we found is, first of all, a lot of participants in our sample were experiencing moderate to severe psychological distress. And many of them were using cannabis for medical reasons. So more than half of the participants in our sample used cannabis for medical reasons. And about 55% reported using without a medical document from a healthcare professional, whereas 5% used with a medical document. In terms of patterns of cannabis use, we also found, again, that a number of people had indicated that they increased their cannabis use, so 60%, due to the COVID-19 pandemic. And the reasons for that varied from things like boredom to stress and anxiety. It will be really interesting to follow this cohort further to see if those individuals who did increase their cannabis use during COVID are still increasing their use, or if that's changed over time. So that's something that we will be following up on. In terms of health campaigns, so when we're thinking about different resources that may be helpful for people, we wanted to know what health campaigns they had even seen in the last 30 days. And what's interesting is that the number one way in which people are seeing the health campaigns was through social media, but 33% indicated that they had not seen any health campaigns at all, which again highlights a need for developing better health campaigns that are reaching the target population. And then in terms of the topics of the health campaigns, the highest proportion indicated that they had seen health campaigns around driving and cannabis use, so 58.6% indicated that, followed by cannabis in young people and their developing brains, information on that. But what's also really important to note is how few cannabis users had actually seen anything on the lower risk cannabis use guidelines. And I think that's really important to note because we know that if people are looking for more messaging around how to lower their risks from using cannabis, these are important guidelines that they should be aware of. So to summarize, there are gaps in supports that are available for those that may want to change their cannabis use patterns. Many of the people in our sample who use cannabis were using it to treat mental health or medical symptoms. And a large proportion of people who use cannabis do not see any health campaigns about cannabis. Over half of young adults had seen campaigns around cannabis and driving. But it's particularly important to increase the visibility of the lower risk cannabis use guidelines so that people are informed about how to lower their health risks. And the overall implications of our findings are that there are some increases in patterns of cannabis consumption in the short term in Ontario, but we need further evidence to examine these longer term impacts. And I think that's where we're seeing some differences in what different groups are finding. And it's particularly important to look at these longer term impacts given the expansion of the cannabis retail environments. We also noted that older adults would be an important priority for future educational campaigns, raising awareness about the harms of problematic cannabis consumption and the risks of driving under the influence of cannabis. So this is a group that maybe used cannabis earlier on and are starting to use it again, but we know that cannabis is different than when these individuals may have been using in the past, and it's important to have better education campaigns focused on this group as well. Additionally, there's a need for more resources around cannabis harm reduction and ensuring that people are able to access those resources. For example, we could be having information like the lower risk cannabis use guidelines perhaps being available when people are purchasing their cannabis. Okay, and that's it. We're ready to take questions.
To get to it. So thanks for a great tandem presentation. I did have one question about the driving accidents that you looked at. It seemed as if your data went up to about 2019 in what you presented. so about 1 year after legalization. But I also would think there'd be some issues with running into the pandemic around that time as well too. I know I certainly was doing almost no driving during the pandemic. Everything was by Zoom and remote. I wonder if there's any subsequent data to that you have to see if those trends for no change in accidents has sort of continued, or if after the pandemic has started to loosen up the restrictions, maybe you've seen that change a bit.
So I think one of the significantly. So it's a bit difficult to put the time series from before and the time series from after and do a combined analysis, because it's hard to attribute the changes if we observe any. Are they due to actual differences, or are they due to because of the changing in the methodology? With that being said, we are anticipating new results coming from the OSTIS this year. So I think it'll be interesting to see if we have any of those changes. And for the Ontario, I think the Ministry of Transport data, I think we also stopped at January 2020 as far as I know.
Okay, thank you.
Hi, just to echo that, great presentation. I have a question about, you talked in the first half of the presentation and you showed some kind of like pretty large numbers in terms of increases after legalization. And as a point of clarification, you said you pooled the data, so it was kind of binary, like pre-legalization and post-legalization. Is that correct?
Yeah.
So I'm wondering, in your opinion, do you think that those kind of large increases that you saw were kind of, that legalization was a specific precipitant to that, or is it at least somewhat reflecting kind of what we saw Dr. Hammond talk about earlier today, which is just a general increase in trend over time, since you aggregated so much data pre-legalization?
So there's two things to consider over here. One is we actually did try to account for the trends over time by specifically including like the survey year within the models.
Gotcha.
And then second, we actually didn't present it over here, but if you, in the papers, we actually conducted supplementary analyses. So what we ended up doing was we split the pre-legalization period into two different periods, basically. So I think the first one was from 2001 to 2013. And then we have from 2014 to 2018, and then 2019. So even when we compared that middle period where we see the steep increase, the 2013 to 2018 versus the 2019, that comparison is still significant. So I just haven't presented it over here, but we have looked at that as well.
That's great. I'm just curious, was it as large as kind of like the overall outcome, or was it dampened like a little bit?
I can't recall.
Okay, that's okay. I'll definitely take a look.
Challenging.
I'll take a look at the paper. Thank you.
Yeah. You're welcome.
One online question, actually. In a recent visit to a local cannabis store, I noticed no signage or posters, nor did I find any information about health risks or harm. Is there evidence that putting up appropriate posters regarding pregnancy risks, etc., and providing information that is in line with the lower risk guidelines in stores is beneficial?
I think that would be a better question.
Yeah. So, I don't know that it has been tested, but I don't see any harms to it, and that's something that I would definitely recommend, especially based on what we were seeing in the qualitative studies. So the fact that a lot of participants were talking about getting their health information from the people that were working in the stores, and that, they would tell them about different strains and how that might impact the body, but they're maybe not the most appropriate people to be providing health recommendations. So having additional supplemental material like that, I think, makes absolute sense. And lower risk cannabis use guidelines in those areas, I don't see a harm, and certainly we could evaluate the impact, but it's a pretty low cost intervention that could be implemented.
Just to follow up on that question, to what extent can you describe what the training is for so-called bud tenders in cannabis stores? My understanding is that it's pretty limited, and that in Ontario, at least, the curriculum is funded by a for-profit company, but it's not something I know much about, and they seem like a potential vector for public health benefit and education. Could you speak to that at all?
You actually know more about it than I do, but certainly it would make sense to have them as a potential vector. I mean, there's the issue of potentially a conflict of interest there, but they are there in the moment. So it would be interesting to see whether or not there's the possibility of providing more training around public health promotion and understanding lower risk guidelines.
Hi, I just want to say right at the top, I've been using these databases since 1978, and they've been fantastic. I've always appreciated them, so thank you for keeping them going. One of the things I remember, and I'll acknowledge off the top, my memory might be wrong on this, but maybe you've looked at the data more recently, is when I seem to remember looking at the data from the late 70s, 80s, and 90s, the OSDOS data now, the adolescents. There seemed to be a fair bit of fluctuation over that time period, which was different from the adults. The adults, not much, but adolescents seemed to be less stable, and it fluctuated in the absence of any major changes in policy. And so that's interesting, because it raises a question, is maybe policy isn't the only factor or the most important factor in changing adolescent use. I mean, maybe if the right pop star says something pro or anti, right, that could have, just as an example. Can you reflect back on the data from that period and tell me if my memory's flawed? It's okay.
I think it's an important point that the great thing about OSDOS is that it does go all the way back to 1977, and that even if there are those fluctuations, because it's every couple of years, you can see what is the general overall trend, and that's important. So if we actually compare cannabis use now to cannabis use in the 1990s, it has declined, even though we are in a period of legalization. So it's really important to actually contextualize those issues as well.
And I think just to follow up on that as well, I think when we have conducted these studies, they are observational studies. So we are also very careful to say that these are associations, because this is repeated cross-sectional analyses. It's very low, like low level of, we cannot establish causality with it, right? So because of that, we have been very careful to phrase these as associations, because there is always the issue of residual confounding.